Good day. So for today's procedure, I'm going to assess the mouth and the oropharynx. So the mouth and the oropharynx are composed of numbers of structure and of the lips, oral mucosa, tongue, and flow of the mouth, teeth, and gums. So the purpose of it is to indicate a person's general health. So the equipment that we will need is a clean gloves, a tongue depressor, gauze pads, and the pen light. So consideration before and during after the procedure. So if possible, arrange for the client to fit with the head against from surface such headrest and examination table. So things to document after the procedures, we have to make sure that verbally communicate to professional healthcare or healthcare team number for findings for the interactions. So our first procedure is we have to inspect the outer and inner surface of the lips, nothing symmetry of contour, color, texture, and lesions as the client to pursue his lips. So variations in color and texture may indicate poor nutrition, dehydration, or hypoxia. And then lesions may indicate herpes simplex of other contagious skin infections. So ma'am, purse your lips. And then inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and any presence of lesions. So careful inspection may reveal nodules, lesions, and first sign of mumps and measles. And then ask the client to open her mouth. So this is for the assessing the oral cavity. So now open your mouth. And then remove the dentures if any. If able, you may ask the patient to do this himself or herself. So inspect the condition and breathe. So this is to inspect the gums clearly. And then inspect the teeth and gums for discoloration and decrease of lip or missing in teeth. So this is to determine any swelling in the gums. So inspect the roof of the mouth for color and structure. And then inspect all surfaces of the tongue and the floor of the mouth. So this reveals lesions, color, texture, and size of the tongue. And then ask the client to protrude her tongue, and then inspect the upper surface for color, texture, and position. So this may reveal signs of vitamin and mineral deficiency. So beefy red tongue indicates the vitamin B12 deficiency. So ma'am, protrude your tongue. And then have the client place the tip of his tongue on the roof of his mouth. So use a pen light and inspect the underside of the tongue. And then frenulum, floor of the mouth, and then the submaxillary glands. So reveal surface presence of veins and saliva. So to visualize any oral malignancies and that develops in the area under the tongue. So ma'am, can you put your tongue up?
Can you please?
And then ask the client to roll his tongue upward, downward, and from side to side. So this is to check the tongue movements. So ma'am, can you move your tongue upward, downward, side to side? Okay. And then wear the gloves and palpate the tongue and the floor of the mouth. So this is to determine the abnormalities in the tongue. So ma'am. the left and examine it. Then do the same to the other side. So reveal lesions or patches on the sides under the tongue where malignancies are common. The client to tilt his head back and open mouth as wide as possible. So this is to have a clear view of the mouth. So ma'am, open your mouth right wider and then tilt your head. So use a tongue depressor and shine a pen light to the oropharynx. So this is to detect any information and infection. And then inspect the hard and soft palate and then tonsils. So note the color, shape, texture, and conditions. So this is to check if there is any infection on the palate. And then to inspect the uvula, ask the client to say ah, and then watch the uvula as soft palate rises. So inspect its position and mobility. Any deviation to the right side or absence of movement indicate nerve damage. So ma'am, say ah, ah. And then inspect the tonsils per color, ulcerations, exudate, and the enlargement. So tonsils that are swollen, bright red, or have exudate may have infection. And then test the gag reflex by touching the back of the soft palate with the tongue compressor. So this is to check.